Ringing in the ears is called tinnitus or tinnitus, and about 1 out of 5 of us have it. It's a very, very common thing. It's something that can happen as our ears get damaged. It's a side effect or a symptom of ear damage. Sometimes it can be a symptom of a tumor or even a hair lying on the eardrum. But if somebody has a sudden, if it happens suddenly, or if it sounds like it's pulsating, I think those are 2 times to see a physician for. That might be something, a medical issue there. So I would suggest that. I get a lot of questions from my patients. Can I do anything with my ringing? The tinnitus. One, there's no cure for it right now. So there's really no cure for tinnitus. And most people don't have a problem with it. I have it myself, and I hear it at nighttime when it's quiet, and that's when it affects most people. And you kind of hear it, and it's like the fan noise in the back, you just kind of ignore it. We do have a population where that becomes quite loud, like a fire engine siren, 24/7, 24 hours, 7 days a week. Those individuals need some help. And to be honest, what happens is when the ear is damaged, the hearing ear is damaged, and it sends the brain a sporadic electrical signal, and our hearing center in our brain is taking that signal from the ear as sound, and that's the hissing and the buzzing and the chirping sound. So it's doing something in the brain that way. But when people have that really hard, difficult time with it, the emotional system in their brain with stress gets heightened, and the fight and flight system of their brain gets activated too. And when those 2 get activated, the brain is like a radar and just starts attaching itself and focusing on that tinnitus all the time. And what we have to do there is, 1, we have to first diagnose it in a way that I can measure subjectively. I can do a questionnaire. I want to see what's the severity for them. And then we have to do a hearing assessment. Is always good to do if you have tinnitus. It's always good to see where the damage is done. And then if it's a medical issue, medications can sometimes cause that too. So talk to your physicians about that if you change your medication. But if they, after that exam, and we can look at the severity and see if it's affecting them, then it's a lot of counseling. One, it's counseling, talking about what the brain is doing, help them realize that there is help. I think when we say to them, you have to deal with it and live with it, some people that doesn't sit well. That makes it even worse because their stressful system gets even higher. Or a lot of times hearing aids will help, to be honest. About 60% of those patients, if they have a hearing loss, we can place a hearing aid in and it just drops that tinnitus, that ringing down immensely. Sometimes we'll have to put in a little masking noise like an ocean sound that's inside the hearing aid. It sounds like the ocean rumbling, or a little bit of a shh in the background. That gives them, instead of your volume being this loud of the tinnitus, now it's just this loud. So it's a lot, they can handle that. The main thing is counseling, people understanding that their brain is focusing on it a lot. And so if you and I think about that creaky floorboard in our home, it's in the hallway, and if it's during the daytime, we don't think about it much, it creaks. But if you're home alone, at nighttime you're in the bed and all of a sudden that creaks, your brain knows that somebody's in the house. That fight and flight system gets activated quite highly with tinnitus, and so we have to counsel our patients to try to bring that down again. And I tell you what, knowledge is power. When people understand what's going on, how I potentially can deal with this, a lot of help can be done with that.